A spike in COVID-19 in Dedham has delayed the return to school. Officials saying 19 cases and 2 clusters, mostly involving young people who attended parties. Here to discuss it with us is Dr. Kristen Moffitt, an infectious disease physician at Boston Children's Hospital. Good to see you.
Good to see you, Emily.
So we know there's a similar situation in Windham, New Hampshire, too. 18 cases among high schoolers there. I think we've talked about this before, but what can parents say to young people about this? And are there circumstances where any kind of gathering would be safe?
Yeah, I think these are pretty clear examples of the risk of transmission that's associated with large gatherings, especially because they occurred in communities that had pretty good control over community-wide transmission. So in addition to highlighting for high schoolers how these gatherings are driving transmission, an even more effective message might be that if students want to be able to safely attend in-person classes, or if they want their favorite other activity to be able to restart, or their sports program to keep running, it's really critical that they don't let their guard down and lapse in the recommendations on how to reduce the risk of transmission. And maybe accompany this with encouraging them to make plans for safer get-togethers. And this would include keeping it outside, keeping it to small numbers, and still the physical distancing and masking that we know works to reduce transmission.
So I think we had discussed, we knew there would be cases at school, right? There was never going to be 0 cases. But what's an acceptable level then can be contained and still allow kids to stay for in-person learning?
Yeah, this will vary a little bit in every school setting because they'll all be a bit individualized. But in general, a single case in a classroom would not necessarily indicate that that classroom or that cohort needs to close. But a critical follow-up to any single case will include investigation of that individual's exposures outside of school, and as well close follow-up of the contacts that individual had. Because if at any point the evidence suggests that the case likely did come from transmission at school, or if there is an additional case associated with that first case within the close contacts of that individual, that's really the point at which school and district officials will need to review with public health officials whether or not that class or that cohort should take a pause. Or similarly, if there are serial cases across different classes or cohorts, or if community-wide transmission is on the rise, that would be the time to have those conversations too.
All right, Dr. Moffitt, always such great insight. We really appreciate it. Thank you for your time. We'll see you next week.
Good to see you.